Naomi, Alicia is here to see you today.
Hey Naomi, how are you? Good. So tell me, what's been going on? My name is Alicia and I'm an occupational therapist, registered and licensed. I have a bachelor's degree in occupational therapy. I've worked in mental health settings, nonprofit organizations, as well as in the hospital, psychiatric units from children as well as adults and elderly, and home care setting. I see BJC as an employer of choice because we have the facilities here in St. Louis that are rated extremely high across the board. We have the doctors here and the research to support what we're doing. We're better to access that information than work for the employer that has that. What I'd like to do first is to take your vitals. The number of patients I see in a work week is variable based on the area that I have to work. Approximately about 20 patients in a 5-day work week. In the wintertime, we might have a lot of weakness from pneumonia, breaks or fractures because of the ice or the snow. It can be variable from a stroke to a car accident. A typical day for me is we have a laptop that we use to communicate with our patients, all of our patient information, the notes. I communicate that in the morning so I can see if there's any new updates of the patients. I have a preset schedule that preferably I call them the day before, the night before, to schedule my patient caseload. And then I drive to the patient's homes and have a visit for approximately an hour based on if it's an evaluation, a first-time visit, or just a follow-up visit, or it could be a discharge. Naomi, I want to take a look at your hand strength. So go ahead and give me your hand. I have excellent support working out in the home care setting. I have support from the office staff and my supervisors in the office. I can call them at any time to ask questions. I also regularly, with visits, call the nurse and the physical therapist and the social worker that I'm working with, as well as the aide, to make sure that we're all on the same page and providing the best care for the patient. A lot of therapists will have a double major in psychology as well. I find that that's helpful with working with individuals in the field. Someone might be dealing with pneumonia or having a stroke or weakness, but regardless, it's a change, and that's grief, and to be able to have the coping skills to work with that individual to get better is beneficial. My job is rewarding as I see patients improve their lifestyle, their independence in the home, and it's in their home, and that's where a patient wants to stay. So if I'm able to provide that to them, I've done my job. And really, when you bring in your hand up towards your shoulder, try to keep your hand straight. Here you go, Naomi. Here's all the exercises that we kind of talked about and instructions. Do you have any questions about that?
No.
Okay. If I were to speak with an individual, an occupational therapist whose experience has been in the field for a while, and they're interested in home care, I'd have them speak with us. Come, observe us for a day, 2 days if needed. Recently, I did have a therapist that came and observed what we did, and she did end up coming and working for home care. I think that's a way to get a good feel for it. Interview with the team. I will see you next week. Thanks so much, Naomi.
Thank you.
All right. What I enjoyed the most about the home care setting and the patients, it's different every day. You're going to arrive at a patient's home and learn something new about that individual. Each person's different and has a different story to tell. I learn as much from them as they learn from me, hopefully. I see myself here with BJC for quite some time.